Welcome to Care Radio. In today's episode, we'll be focusing on a common and significant issue faced by many chronic kidney disease patients: urinary tract infections, UTIs. The interplay between CKD and UTIs presents unique challenges due to altered physiology, immune dysfunction, and the complexities of managing an infection in an already compromised renal system. This essay explores the pathophysiology of UTIs in CKD, their impact on kidney health, diagnostic challenges, and management strategies tailored to this vulnerable population. Reduced kidney function in chronic kidney disease, CKD, can lead to a variety of complications that increase the risk of urinary tract infections. Urinary retention and stasis occur when the bladder does not empty completely, creating a reservoir for bacteria to grow. Additionally, CKD impairs the immune system, diminishing the body's ability to fight off infections effectively. The disease also alters the chemical makeup of urine, potentially decreasing its natural antibacterial properties and changing its pH. Furthermore, structural changes and obstructions, such as kidney stones, are common in CKD patients and can obstruct urine flow, thereby increasing the risk of infection. UTIs can exacerbate CKD progression by causing additional stress on the kidneys. Acute infections can lead to acute kidney injury, AKI, on top of chronic disease, further diminishing kidney function. Repeated or severe infections may contribute to the scarring of kidney tissue, accelerating the path to end-stage renal disease, ESRD. Diagnosing UTIs in CKD patients is complex due to overlapping symptoms and alterations in laboratory markers. Typical UTI symptoms like urgency, frequency, and dysuria may be absent or attributed to CKD itself. Additionally, standard urine tests may be misleading because of the altered urinary constituents in CKD. Therefore, careful interpretation of urine culture results and consideration of the patient's overall clinical picture are essential. Antibiotic therapy must be cautiously approached in CKD patients due to altered drug clearance, which can affect both efficacy and toxicity. Dosage adjustments and careful selection of antibiotics are critical to avoid further renal damage and to effectively manage the infection. Besides antibiotics, management includes addressing any obstructive components like kidney stones, optimizing fluid intake to ensure adequate hydration, and possibly using prophylactic antibiotics in recurrent UTI cases. Preventive strategies are paramount. These include regular monitoring for signs of UTI, maintaining good personal hygiene, and possibly modifying catheter care protocols in patients who use urinary catheters. Managing UTIs in CKD requires a comprehensive approach that addresses both the infection and the underlying kidney disease. Early detection and tailored treatment are critical to prevent further kidney damage and manage symptoms effectively. Healthcare providers must balance the immediate need to treat infections with the long-term goal of preserving kidney function. Ongoing research and clinical trials are needed to develop better strategies for managing UTIs in CKD, aiming to improve quality of life and outcomes for these patients. Thank you again for joining us here on Care Radio.